See, I'm always concerned because the way I see it on my phone, it looks like I'm gonna cut off, and then when I look on here, it's perfectly fine. So, okay. I guess so. Let me get some of these screens here closed off. Yeah. Get some of these. Alrighty. That's better. Too much clutter. Learn from me, guys. Make sure you're getting rid of all the tabs you have open. I don't know how I end up with so many freaking tabs as I'm working throughout the day on doing anything. Hi, Rachel. Hi, Patel. As I'm working on anything, I find myself with like a ton of tabs open. I don't know if y'all are like me and that happens to you, but that happens to me. And I'm like, by the time I know it, I always think, oh yeah, I'll go back and I'll review whatever or I'll read whatever. Cool. All right. So today's episode was inspired by a comment that I got, and that I'm going to read. And it was, okay, so it was a little mix of a couple of things. So a viewer had commented that she had wished that she had never found this, or how did it go? How did it go? Because I want to say it right, because it was really good. Okay, here we go. I can pull it up here. Yes, I wish I had never picked this career to learn, was the comment. And so I said, maybe it picked you. And I say this because sometimes medical coding picks us. And then when we get stuck in this position of having to look for a job or just trying to pass a test or getting through the school, then we're like, why the heck did we get into this? Like, why did I pick this field? And I think we pick medical coding for different reasons. I always say it all the time, medical coding found me. Like, it literally sought me out because I did not know anything about medical coding. I had no idea it even existed until I got into the program. And by the program, I meant the WI. It was called the WIA back then, the Workforce Innovation and Opportunity Act. Now it's called WIOA. So that's what it stands for, Workforce Innovation and Opportunity Act. And when I was in there, they give you all these programs to retrain you, and I didn't know anything about that. I didn't know that there was programs and things like that. And so when I got involved in that, my case manager, I told him, he's like, well, what are you interested in? And I was like, oh, the accounting, because I like numbers. I can do numbers. And he said, well, what about medical coding? I said, oh, I don't do nothing with needles. I was very self-assured, yeah, I don't do nothing with needles. And he says, oh yeah, it's actually not needles, it's your reading. And so that's how I got into it. But different people have their different reasons of why they get into it. And when I got into it, it was because I was trying to turn my life around. I was at a point in my life where everything was changing. And I think the mentality that you have going into it also plays a big part in how you're able to handle these struggles that come along. And so in this comment spurred another comment, and which is what inspired today's episode. So thank you all for joining me. We're going to go ahead and get started. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Today, we are talking about avoiding the pitfalls of finding your first job in medical coding. As we all know, or if you haven't experienced this yet, you will. It is difficult to find your first job. Everybody wants experience. Everybody wants you to have 2 to 3 years of experience. I think this is a cultural thing in this industry that can change, but it's going to take time and it's going to take effort. This is why I tell my people who are in the degree programs right now, who are watching my channel and trying to figure this whole thing out, if you ever get into that position where you're having to do the hiring, consider hiring new people with no experience. Employers are inherently lazy. They don't want to have to train you. They want somebody who can be plugged in and you're free to go. And it's not that way when you have brand new students coming out of these schools, particularly these predatory schools. And we all know they're out there. that will shove you through like cattle and just get you on through and train you on how to pass the exam, but not really understand what you're doing. And that does happen. So there's a few things that go into this. The student needs to be prepared. We have to know what doctors know while never having gone to medical school. We have to know a lot. It is the medical field. We're not touching patients, but we still need to understand this very complex documentation. So the viewer commented on my post that I was responding to that post. And that's what I was saying, is that sometimes medical coding finds us, you know. And so this other comment says, completely agree, still no job. Took all the steps I need to take, had resume done, passed the exam, doing Practicode, even went to another state to interview for an externship, got the internship, couldn't do it because of financial reasons. It was unpaid and in Florida, where finding a place to stay costs thousands. Now applying for another one in a different state. Let's hope it works out. Oh, and gave up being with my husband for a year or two. Just going state to state looking for a job. Well, clearly, this was my response to that. You shouldn't have to go to that extent. Have you considered working in an alternative position like medical records just to get in? Have you registered yourself with a temporary agency for medical professionals in your area? Did you list your skills on your resume? I know you want a medical coding position, but sometimes you have to start in an alternative position to get in. You should not have to leave your family, your spouse, to go and find a job in medical coding. I have said this so many times. Not all of us start our journey as medical coders right out of the gate. Now that may be what you want, because Bleu, I went to school, I spent all of this money, I want to start out as a medical coder. In health information and being in the medical coding field, you cannot ever settle into that all or nothing frame of mind. If you do, you're going to set yourself up for failure. Now, this viewer leaving her spouse and going off to another state to spend money to get work experience and not get paid for it is not really strategizing trying to get in. Don't do this, guys. Don't do this. Now, I had to move, but keep in mind that I had my mother's financial support to support me, to help me move. And I had a lot of things going. I already had a job that was going to pay me. So I had a job waiting. That's why I was able to move. And my mom being there to support me emotionally, financially, everything. And I was able to make that move. And I was able to make more money being there. So everything worked out, and I paid my mom back, and I did all of these things, and that was great. But the thing is, when you go to these extreme measures and you go to another state and you're going to work for free, you should never work for free. We have a training that takes money, it takes time to get. It's not like we're just learning something for free and then, yeah, we work for free. This is not for free. This is your time, your money, your time away from your family. That's value. And you should never undersell your value, which is working for free or paying somebody for an internship, which I've heard before, and that is disgusting. But it happens and people get taken advantage of. Do not get taken advantage of. I've heard of some employers say, oh yeah, we want you to have a degree and we'll pay you $12. Get out of here. $12, really, an hour for somebody who has a degree? No, I don't think so. Now, if you cannot find a job, you're looking and you're trying to find medical coder, you don't find anything, everybody wants experience, you're still supposed to apply anyway. Because every place that has somebody working, right, all these employers with experience are going to be employed unless they want to be somewhere else, unless they want to try something else. So sometimes these employers will get so desperate that they will take a chance on somebody new, but you have to bring your A game. I see a lot of brand new medical coders fall into that self-pity, that no one helped them, they don't know what to do, and they pay somebody else who's either not a medical coder to write their resume, or they pay somebody who says that they, oh yes, we do medical coding resumes, and when I see that stuff come out of there, are you kidding me? You're telling me this person was trained in ICD-10. ICD-10 what? ICD-10-CM or ICD-10-PCS? That's number one, and you get that wrong. You know, when these resumes go through these little scanner machines, they're looking for complete phrases and words. If in that job posting it says candidate must know ICD-10-CM, that needs to be on your resume, not ICD or ICD-10. It needs to be spelled out, ICD-10-CM, not any of this ICD-10 or ICD-10 or ICD. So it's all about the details. It's all about, okay, this person told me no. All right, I'm going to keep going. And talk about in specifics, what were you trained on? Well, Blue, I'm coming from a background that's not medical. I came from a background that's not medical. A lot of us come from backgrounds that are not medical. I have never in my life touched a patient, known what it's like to draw blood or do any of that. I've never known that. And I've never had to. So when you're doing those things, when you're looking at what you have to offer, what were you trained in? Be very specific. Were you trained in outpatient medical coding, meaning that you were trained for the CPT book? Were you also trained in inpatient medical coding, which includes the ICD-10 PCS training? Were you trained on those things? List those things on your skills. Your skills need to be specific as to what you were trained on, not your soft skills. Not that you're a team player, not that you're organized, not that you're timely. No one cares. They want specific skills. ICD-10-CM, CPT, HCPCS, ICD-10 PCS, medical terminology, anatomy, pathophysiology. If you think that that's not important, look at any job listing for a medical coder and see how many times they're asking for that. What is your language proficiency? Are you proficient in only English? That's fine. Put that on your resume under language proficiency. Oh, you haven't been putting that on there? That's the thing. Do you speak? Do you write it well? Then you need to put excellent, written and verbal. Do you speak Spanish in conjunction? Okay, great. Language proficiency, English and Spanish. Well, what does that have to do with medical coding? Everything. That one little skill can edge you out against somebody else. Being able to write well, being able to express yourself well on paper goes a long way. And being very detailed also goes a long way, because you can have no background and you can still manage to capture the attention of the employer with a well-written resume. And if you talk to any of my clients that they've had my experiences with my resume writing, they'll tell you that, and they've written about it too. You can look on LinkedIn for my feedback on that. It takes being very detailed in what were you trained in. And if you say, well, Blue, I don't know. Well, what was your program about? You should be able to answer these questions when you complete a program. You should be able to answer those. You should be able to say, this is the experience that I have. If you're a nurse and you're trying to come over to being a medical coder, don't make your resume look like you want to be a nurse again. Talk about the things that's related to the information side of what you were doing, right? Don't stress about, oh, that you were hands-on with the patient. Talk about you documented their temperature, you took their weight, you calculated the BMI. What type of specialty did you work in? Was it mom and baby? Was it family practice? Was it the NICU? Was it the ICU? Where was it specifically? Those types of things capture the attention of people that are looking at your resume. And people who don't have a background in medical, do not be intimidated by people who have background in medical, because nurses still struggle sometimes to understand coding. And I've had many nurses who I've tutored who said, Blue, this stuff is no joke. You coders, y'all are, that's just different. It's not like what I thought it was. A lot of times these nurses, they are selecting codes from super bills, right? These are our commonly used procedures. These are our commonly used E&Ms. These are our commonly used diagnoses. So we're just going to circle, circle, circle. That's not the same as medical coding. Medical coding is actually looking and abstracting and comprehending what we're reading and actually selecting the appropriate codes and putting the right modifiers, and that's coding. So those are the things that sets us apart. So again, don't look at other people and be comparing yourself to them. Every medical coder is unique and different. What you have to do is block out all these other things and be concentrating on what you're doing. Medical coders are listed differently in these job listings as well. They're listed under health information tech. They're listed under revenue cycle, integrity, revenue cycle tech, medical coder, medical biller. And then when you look, they're actually performing all these coding duties. So those are the things that you really have to pay attention when you're looking at these job postings. And I've posted many videos, about alternative jobs for medical coders and what other names that we go under, because not every place is the same. But don't work for free. If somebody's trying to underpay you vastly, like $12 an hour, that's not the place for you. When I first started, and you guys know I don't talk about money in specifics, but I will tell you that there was a university hospital in my hometown that said, oh yeah, we hire coders, but we pay them $10 an hour. Okay, not working for that. I'm not working for $10 an hour because I've been trained. I know what I'm doing. And then in my class, I was the only one to pass the exam on the first try. No, you're not getting me for no $10 an hour. Well, then registering with a temp agency, I got paid a lot more. So there's other alternatives. And for those that don't want to register with a temp agency, every single assignment that you're being put on is more experience filler for your resume. Even if it's just for a couple of days or a couple of weeks, you're still learning about their electronic medical record. You are still learning about how to use their encoder, which there are different brands of encoder. So that's additional skills you can add to your skills list. And meanwhile, you're running around trying to find somebody to hire you full time. You could have been filling your resume with all these temp jobs and making those connections in the field. Just because you start off at a certain dollar amount doesn't mean that's where you have to stay. You know, some people get caught up in that. Again, it's that all or nothing mentality of, oh no, I want this money and I want this and I want to work at home and I want to do, no, guys. Let's be realistic about what we are expecting when we first get out in the real world. Working remotely has changed over the last couple of years because of the pandemic. Before, it used to be you had 3 to 5 years experience, period. They were not hearing it if you did not have experience. Now, because of the pandemic, they're doing hybrid schedules. So sometimes they will train you at the facility for a couple of weeks and then send you home. Sometimes they will just let you start working from home. They'll send you a computer. And also, don't fall into that. Don't fall into, oh, I need to buy a new computer and I need to buy this and I need to buy all this home equipment. The companies will typically send you a computer so they can keep their information secure, along with monitors as well. When I worked for Level 1 Trauma Hospital, they sent me a computer and monitors for my work. I never had to touch my own personal computer because it's a violation of HIPAA to have it on my own personal computer. So I used theirs and that was fine, so that's the thing. People think that they have to go through all of these hoop jumpings and work for free or pay for internships or, pay for all of these other things. And, oh, let me pay for Practicode so I can accelerate the removal of my A. It's still going to show that you have no experience, even though you don't have the apprentice status on your name. And Practicode is not work experience. A lot of people think that it is, and it is not. What it is a product. It's an educational product from AAPC. And they even say that it to them, because the apprentice status requires a 2-year time commitment to have this. So they develop Practicode with the 660 records that you are supposed to code and go through yourself. Because that's what they say would be typical first year work for a new medical coder. And that's for their requirement. Now, of course, it could be different. Every place you go is going to be different. But you want to make sure that you're not falling into that trap thinking, oh yeah, that's work experience. It's not. Because for something to be considered work experience, you have to have production standards and accuracy standards. When you work for a temp agency, yes, you are filling in, and typically there's really not a production standard, but maybe there could be. When I worked at my first job, which is at the Cancer Therapy Research Center, we were just working on backlog, and so we didn't have production really per se, but we did have accuracy. So that was a thing that they would check our work and see what we were doing. And we were working from paper, paper charts back then. So that was ICD 9 times back in 2008. So, let's just get to some of these comments. All right. Hi, Shannon. Thank you for all the blue hearts. Hi, Goddess. Oh, thank you for all the blue hearts. Hi, Ingrid, Tawana. Thank you all. Diana. Hello. Hi, Caitlin. Hi, Floor. Him Kim, I like that. Him Kim. Can I get a job with no experience, just a certificate for medical billing and health information concentrate? Hi, Rita. So, Him Kim, that's a good question. Now, with just finishing a program and having your diploma, this is not, of course, a medical coding certification. Sometimes employers will take a chance on you. It depends on the employer. Some employers will say, yes, we'll take recent graduates, but you must be certified in either 6 months or 12 months. I heard somebody say that they were going to give them 2 years to get certified, which I thought was very gracious. So if you can get in that way, then by all means. But if you have finished a medical billing and coding program, I would strongly recommend that as soon as you can, to sit for your certification, because the longer you're out of that program, the more you're going to be likely to forget. Your earning power will increase with that certification. Okay, so that's an incentive for you to go and get your certification sooner rather than later. And that's the thing, when you complete a program, it's going to make you look more marketable when you have your credentials after your name. Although I have heard of people who started out with just their diploma from completing the program, and then once they were employed for like a few months, they were able to save up the money to be able to pay for their certification exam, which is totally understandable. So if that is okay with the employer, then by all means, go ahead. But make sure your resume looks really good. Just saying. Caitlin, I was able to do this and then got certified a month later. Yeah. So that's the thing, sometimes people just need that first paycheck. Just give me my first paycheck so that I can go get my certification. And sometimes that's what it is, because that's why I tell people, especially when you're starting out in the beginning, you only need one certification. I have yet to see a medical coding job listing requiring the candidate to have multiple credentials. Start with one. You don't have to be certified to be a medical biller. So if you have a certification and in medical coding, obviously, and you go apply for these medical billing positions, think about how much more value you can bring to that medical billing place. Sometimes these billers, they get these denials and they don't know why. And it's because if they don't have a certification, they haven't been classically trained in medical coding. They don't really know why. So they kind of have to work with the provider or work with the other coder and things like that. Well, when you go in there and you have your medical coding certification, then it's like, oh, okay, well, I have extra value because I understand why does this need a 25 modifier, or why does this need like a 24 modifier, 57 or whatever modifier you're trying to apply. And why is this getting denied? Okay, well, there's too many units on this. There's a cap of how many units there are. So there's a lot of things that you can bring to somebody in a company that does billing. So that is something that you can market because you have a certification. Ask the question, Rita. You don't have to ask a question. This is an open forum tonight. Go ahead. But yes, so please don't take extreme measures to find a job, guys, and don't work for free. You guys have been classically trained in medical coding. Take advantage of your training and use it to your advantage. Use it to your advantage, because at the end of the day, these employers will try to get you as cheap or for next to nothing as they possibly can, because you are very valuable. And even if you have no experience, you're still valuable because you know the rules. You've been studying, you've been going through your workbooks. And if you haven't, if you're looking around like, yeah, I've been doing that, you need to get to those books, because the learning doesn't stop. And it's not an excuse if you say, well, I have no experience. That's not an excuse for you to stop working with those workbooks. Sometimes people are rather gleeful when they get done with their program and they say, oh, I don't have to do any more studying. Oh, no, 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 friends. You have to continue to study. It is not something that ever stops. You have to maintain your credentials with continuing education units, and you're constantly learning with those too. And where you get these CEUs really does affect how much value you're getting, because not all CEUs that are provided or that that you're paying for, not all of them are good, so you got to watch where you're getting those CEUs from. You really do need to concentrate on learning something, and especially something that benefits wherever you're doing coding at. If you are, working in peds, obviously look for some that are involving, pediatric coding, or some that would involve evaluation and management coding, something that will benefit you, and not just, hey, I'm getting these willy-nilly because I'm just trying to fulfill a education requirement. Take pride in your knowledge. Take pride in being a medical coder, because you know what so many of these doctors try to say? Oh, those coders, they don't know nothing. Well, my providers know better than to say that. They know better, because I always tell them all the time, guys, I go through stuff that y'all have no idea what I go through for y'all. And I said, but I'm going to tell y'all this. Y'all are going to be prepared. The second you leave this hospital and you go to someplace else, you are going to be prepared, because I have taught you, I have gone over these things with you, because it's important to me that they are well taken care of, even when they're away from me, because you never know who their coder is going to be. I always hope that when my providers leave, that they have a very good team of medical coders there for them, waiting at their next place. But sometimes that's not always the case. So in those instances, I'm going to make sure that my providers are prepared, because I take pride in my work and I take pride in what I do. I'm just saying on that one. And you're welcome, Him Kim. I like that, Him Kim. Rita says the CCA exam is for people starting out in coding. Yes, it's the entry level. Floor, I tried to ask my instructor questions, but it seems like I get her tired. All she says is anything else. You ever hear the expression, and don't take it wrong, and if you're an instructor and you're watching, if you take it wrong, that's on you. But there's an expression that says that there are some, right? Some who teach, those who cannot do teach. And that applies to some instructors. Now, there are some instructors that they do this because they can't meet production standards when they're working under a regular production environment, or they just didn't do very well. So they figured they would go into something easier like teaching, even though teaching is not easy. Teaching is a very hard profession. A lot of people ask me, Blue, why don't you come up with your own school? Do you know how much energy I put into everything that I do? To put energy into a school, that would literally take everything. I would not be able to work. I would not be able to do anything, because I would be so focused on making sure that every single student knows, and having a good team of people around to be able to teach students so that there is no failure at this school. That takes a lot. And so it's about having some pride in what you do. So when you have a teacher like that, there is nothing that you can do about that teacher. There are some that you're going to just lose out. And a lot of times people will find that out the hard way. So the best thing that I could offer, best thing I could tell you to do is look for other mentors, look for anybody else that can help you, because clearly that teacher has made it to where you cannot ask questions. So you need to find other resources, because the more you try to reach out to that teacher, the more she's just going to give you attitude. When I have to interact with people who give me attitude, it wears me out. So I keep that to a minimum. So I do not ask people that I know that they cannot help me. And I know the teacher is supposed to help you, but that's not always the case. And sometimes when you're quicker to understand that reality, it makes things a lot easier for you because you know that this person is unreliable. Let me go and find somebody else that can help. But that's a shame. Kim, I never coded before and don't have the CCA certificate, but I'm going for the CCS exam. Okay. Christy says, hi, Blue. I attended a billing and coding program last year, finished classes with a 3.7 GPA, and wasn't able to be placed for an externship, and so I didn't graduate. Any advice on what I should focus on now? I'm kind of lost. You could still, that should never have stopped you from sitting for your certification exam, either with AHIMA or AAPC. You know, AHIMA has no requirements on any of their certification exams. I mean, as far as like the CCA, the CCS, or the CCSP. So if you are wanting to sit for a certification through them, look and see what you want. I mean, if you are only trained on the outpatient side, AHIMA has a CCSP, which you can sit for. Okay, there's recommendations on the site of what they recommend that you should have beforehand. Obviously, if you went through a whole billing and coding program, you know, again, that shouldn't stop you from sitting for a certification. I mean, just because you didn't get an externship. So you could still get a job on your own. You know, you could still get a job doing something else, you know, and you could still get certified. That shouldn't stop your certification. You know, the schools are not infallible. They're not end all be all. You know, you can still get your certification. Or if you want to go through AAPC, that's fine too. You know, they have their flagship credential, the CPC. That is the only one that I will recommend. That, in addition to the CIC, are the only two actually. But if you did not have inpatient training, then I wouldn't worry about the CIC. Just stick with the CPC then, you know. There's benefits to going with AAPC. They have a large grassroots movement. Theirs is a little bit more expensive to get and to keep and to maintain, but it does have its trade-offs. So, you know, whatever you decide to do, whether you decide to get certified with AHIMA or AAPC, you still should get certified because, again, it's going to make you marketable. Just because the school, you know, didn't let you have the externship, you can still get a job someplace else, you know, once you get your certification. But sell it. Yes, thank you. But yes, Kim, I'm gonna tell you this: the CCA and the CCS. Okay, so the CCA is your entry level, and a lot of people say, well, you know, if I got training, I should just go for the CCS. Okay, the CCS, I will tell you, is considered the mastery of the inpatient and outpatient medical coding. Now, the CCA is entry level. It's still testing you on a lot of different things, but it's considered entry level. When you have the CCS, more is going to be expected of you because this is an advanced credential. You have to know about everything from reimbursement to the coding rules for inpatient and outpatient, which are very different. You have to know about how to navigate in the CPT book and the ICD-10 PCS book, which is no easy feat. Because what happens with people is a lot of times they will be comfortable with one, but not so comfortable with the other. Sometimes they're really strong with CPT, which the codes are already built and made. And sometimes, you know, they're not so strong in ICD-10 PCS, where you actually have to think and rationalize what approach and what was the intent and what were they doing? Was it diagnostic? Was it, you know, what were they doing? And you have to know about extirpation. You got to know about extraction. You got to know about all of these different approaches to surgeries. And then you got to know about all the other rules in between. So, and you have to know about all the query process and everything else. So it takes time. It's advanced. People who are brand new to the field, I always tell them, if you had excellent training, you should be fine. Some people still freak out, but that CCS exam is physically and mentally exhausting. You have to have endurance and you have to have laser focus. Because if you get distracted easily, sometimes these Pearson View Centers, it's not their fault that it gets loud in there. You have people coming in and out. They're taking different tests, different exams. So, they give you earplugs and everything, but you are on a camera, okay? You cannot get up and stretch or take your test standing. There's a lot of people who ask me that. Well, I work better when I stand, when I do this, when I do that. It's not about your comfort. It's about the rules of the testing center and making sure that everything is fair and appropriate. So that is why y'all need to quit putting those messages retractions, because I keep getting distracted by that. So when you are taking those exams, you've got to follow the rules of those places. So just make sure that you're doing that. Make sure that you are not, doing something that is going to make them question you, like, having your books all written up in and everything. That's another thing too. People think, well, if I write all my notes in here, and if I do all this highlights and tabs and write all these notes, you're not going to have time. You got like 2 minutes per question. And it's between 100 and 110 and 140 questions. Don't give me the line. Hold on. It's either 110. What did I just blank? On the CCS exam. I'm not trying to tell you this to discourage you. I'm just trying to tell you to be prepared. That's what I'm telling you. And I probably should have said that first, because, I don't want people thinking that I'm trying to discourage, and I'm not. If you've been on my channel long enough, you know me better than that. The amount of questions is, 115. I was wrong. 115 and 140 total items. And this is not easy. It's a 2-part exam. You have your first side is multiple choice, and then you have your case studies. So again, however fast you think you are, you need to be faster. However quick you think you are with that book, you need to be faster. And it takes literally getting to know your books and opening your books and looking at them page by page by page. And people will stand around asking me questions. Bleu, why? This is what I did when I took my exams. I took the CCSP and the CCS last year, and I passed them both first try. I'm telling you what I did. That's what set me up for success. When you look at every single page in your book, you don't have to read everything. You're just looking at it to familiarize yourself with it. You know how many people are intimidated by seeing these big books, these big, bulky, heavy books? They're so intimidated that they won't get comfortable with the book. I can flip open to this page and know exactly where I'm going. I know this book forward and backward because I've spent so much time with it. Same thing with my diagnosis book, same thing with the PCS book, same thing with the HCPCS book. You have to know where to find the answers. The books have the answers. You just have to know how to use your book. And not only that, there's a lot of anatomy tables. There's a lot of medical terminology, like little cute listings throughout the book, and it will help you. So take the time to review all of your books. Open up and look at every single page. I heard of an instructor saying that he gave an open book exam and the students failed it. Why did they fail it? Because they didn't know their book. You have to know the book, folks. And if you're sitting there saying, well, I do some study. How long are you doing? Well, I do like an hour, and then I take maybe 30 minutes. And guys, you need to start getting committed to a schedule. Now, it doesn't have to be a set in stone schedule, but you do need to look at the amount of hours that you're putting in. If you are not putting in the time, you're not going to get the results that you want. That CCS exam has chewed up people, literally, because they thought they had it. But what happened was they weren't fast enough. They were maybe studying, but they weren't also testing themselves on their speed. And then some of them would get so dependent on the AHIMA CCS exam prep book. Now, I'm going to tell y'all this. I'm certified with AHIMA, but I will say that I do not recommend their study books, the CCS exam prep book or the CCA or the CCSP exam prep book. I do not recommend their brand of book. The reason that I don't is because I think it's pretty well known that those questions are not going to be on the exam, but you would not believe how many emails I get angry from people. I spent this much money on this book and none of those questions were on the exam because they're not supposed to be. All of these exams are different. Every single person has a different exam. Nobody has the same exam. Literally nobody has the same exam. And that's because AHIMA does this to protect the integrity of these credentials. That's why when you have an AHIMA credential, that says that you've passed a very rigorous exam. Same thing for AAPC. But I'm just saying that these tests are not the same. So that's why I want you guys to know that if you're going to bypass the CCA and you're going to go straight for the CCS, be prepared. Time yourself. Get into a space where you can put your phone away and you cannot be distracted. Get in there for those 4 hours that you know that exam is going to go, and test yourself. There's other exam prep books out there, but what I have said to do if you're going to prepare for the CCS exam is to work, and the way that I do things is unconventional, but it works, y'all. I'm telling you. Get through this workbook. This is the ICD-10 CM and ICD-10 PCS coding handbook, right? This is with the answers. Don't get the one without the answers. But this is a 2019 book. This has the same questions as a 2021 book, and it's way cheaper. So I say to study with this. Use this. It has test practice scenarios in the back. So this is going to be testing you on the inpatient coding and the diagnosis coding. So this is something that you want to work with in order to prep yourself. And then there's this, the AAPC CPC study guide. Blue, really? To study for the CCS, you say to use a CPC. This is using the exact same CPT book that we all use. If you use this one, I'm telling you guys, this is what I use. Now, this has rationale in it. It has the answers. And not only that, it breaks things down. And there's a couple of ones that I didn't quite exactly agree on the coding, but that's okay. For the most part, everything is really awesome. And there's a lot of really good explanations in it too. If you find some codes have been updated, it's just some codes are updated. Codes update every year, but this is also going to be a fraction of the cost from something that is more recent, which is going to be way more expensive. So use your resources, use your money wisely when you are investing in these books. Use these to study so that way that you can get practice in and you can be prepared. And also, if you get the Optum 360 books, this is not an ad for Optum 360, but you guys know how much I love them. Now, I love them for a reason, because Optum 360, their ICD-10 PCS, the one that's spiral bound, is the one that you can use on your exam, depending on the year. Obviously, if you're going to take it after April 30th, so May 1st, you're going to have to go into 2022. But this in the back of the appendix, it has a whole list, in Appendix M, it has a whole list of questions that it asks you. Go through and work through those. In the next chapter, in the next appendix, it has all of the answers. So use that to kind of help you work through those, so that way you can get familiarity with the book. Because when you're sitting there going through that exam, oh yeah, you're going to be flipping through books, because it's not broken down into outpatient coding and then inpatient coding, and no, it is mixed up. So you're having to turn your brain on, turn your brain off, turn your brain on, turn your brain off. 2 minutes per question. You got to watch that clock. You got to be able to get through. I got through with 8 minutes to spare. And that was freaking scary. 3 hours and 52 minutes. Comparatively to when I took the CCSP exam, I had an hour and 10 minutes, hour and 20 minutes to spare on that exam. And that CCS, oh yeah. CCS, man, I was coming out of there like Tyson and Holyfield. It was bad. It was bad. I was so tired. But I passed it. But I'm also a 13-year veteran, but who does not have any inpatient coding experience either. My coding home has been on the outpatient side. So, that's the thing. If you're brand new and you have no experience, you got to really dig deep if that's what you want. All right. So let's see. Okay, I'm trying to look for a last answer. Justin, I'm going for the CCS. I studied my ICD-10 PCS yesterday. Yay! Mario, I'm graduating at the end of January and taking my CPC. Is it possible to get a remote job this early in the stage? You must have just joined me. Shannon, does computer-assisted coding mean using an encoder, or are they two different things? It's two different things. Computer-assisted is when it's going through, like in Epic, the doctor will like type out their note or whatever, and the system is selecting the codes for the provider, right? And an encoder is when we use that. It's like an electronic code book, right? So we type in like fracture, and then it'll give us a decision tree. So I'll start off with like traumatic, compression, and it'll give you a bunch of different ones. And then if you say traumatic, so then you select traumatic, okay, where? And then you type in the location, and then it'll give you more and more on the decision tree. So that's an encoder. That's the difference between computer assisted. Computer assisted is looking at the documentation, selecting what it thinks, which it's wrong, right? It's wrong a lot of times anyway. It's selecting what it thinks it sees, because that's the thing with these AI software thingies. You literally have to understand and be able to reason out. It's just looking for words, in which that doesn't work, because there can be patients who come in who have a history of something, and then it's trying to pick up that history code when it's not even relevant to what's going on. So again, yeah, that's the difference. Christina, I just graduated and I'm nervous. My books expire in April and I feel like I have to pass my exam the first time around. Are you taking an AHIMA exam, Christina, or are you taking a AAPC exam? Justin, same Christina. I don't get to take my exam till July, so my books expire anyways. That's like $200. Gail, when I sat for my CCSP last month, there were engineers taking their certification exams. Their exam only takes 2 hours, where the CCSP is 4 hours. Keith says, how does utilization review management place? How does utilization review? Okay, I don't understand. Rita, Blue, you answered my question. I did answer your question. I did answer your question. Okay. All right. You saw it then. Okay. I have a chart where I hate that. That's so annoying to me. When people think I'm not answering their question, I am answering your question. Sometimes it takes me a little bit because I'm going up to that part, but I will get there. I just don't like to be rushed, especially when I'm trying to tell the story, because if I miss any part of it and I go fast, then people are still like, well, wait, and then they have a bunch of questions afterwards. So if you ask a question, I did answer you. I've answered this question several times, and I know that you've actually been in on another live where I answered this question as well. So I have a very good memory. I know who you are. Flora says, I have a chart where I was assigned a check mark after I study my 3 bulky books. Justin, a 4-hour exam without breaks. I'm going to wear diapers. Gail says, Justin, you will be too engrossed in the exam and won't even think about a bathroom break, but the engineers got one and I did not. I mean, you can, but it goes against your time. So just keep that in mind. And Justin says, reminds me of what teachers would say before I went on a school trip. use the bathroom before we go, because you're not going to be able to use it for a while. Although I don't think I can actually schedule the exam until April, because I have to wait for the 2022 test to become available. Right now, Pearson VUE only has 2021. Donna, we appreciate you, Blue. Take your time. Thank you, Donna. I appreciate that. It's just, I don't like when people get pushy. You know what I mean? It's like so demanding. And I don't know. I think it's rude, especially when I work so hard to try to explain things. And it's like, and I have so many videos about that particular subject, right? And so it's just like, okay, let me just get to it. I don't know. Jada. Hello, Blue. Hi, Jada. Do you have to know all the levels of PSIs, or do you think just know that basic PSI and the patient safety indicators are hack? So there are really good references out there, especially on CMS, about hacks and hospital-acquired conditions, if you guys don't know. So that is something that on the list of domains for the CCS, they talk about that. Knowing your patient safety indicators and knowing your hospital-acquired conditions, because it's part of it. When you are sequencing on the inpatient side, obviously the insurance is not going to pay for a hospital's mistake. So if there are certain conditions that fall under that hospital-acquired, like hospital-acquired pneumonia, obviously they are not going to pay for that because, or any services that are related to that, because of the simple fact that the hospital was the one who was at fault. So that is something important to know. But if you Google patient safety indicators, or if you Google hospital-acquired conditions, lots of lists will come up. But if you go to the CMS website, it's the Medicare Learning Network, you will learn all about patient safety indicators and hospital-acquired conditions. Thank you, Flora. Regina, I think you do a very good job explaining. I just found your channel and I value your information. I appreciate that. Okay. And I got to get rid of a troll. Come on. You're welcome, Jada. There we go. All right. Ingrid, you do extremely well explaining everything. Thank you. Good. I'm glad. Thank you so much. But when you are getting into these programs, hopefully they're explaining these things to you guys, but also when you look on the association websites, either the HIMA or AAPC, they do really good about explaining what they're covering on these exams. And yeah, I know it's kind of like, but I did a video way back in the day. I looked at it the other day. I was like, oh my gosh, I was a hot mess back then too. What I did was I had my whiteboard up and I had listed all of the credentials for AHIMA on one side and all the credentials for AAPC on the other. And I was giving like a brief explanation of like what was what. And so it's like, well, I did pretty good on that one, but I mean, at least it broke it down. I mean, what was outpatient, what was inpatient and outpatient. So, hi, Yolanda. Long time no see. Thank you for all the blue hearts. But yeah, guys, I appreciate that. I appreciate y'all being appreciative, because sometimes it's hard. It's hard as a YouTube creator when you're trying to explain things, especially you explain things to brand new people. And you hope that you explain it in a way that they get it, because I know it's a lot of information. When you look at all the things that we have to know as a coder, but then you got to factor in like everything that they expect you to know with the associations and then the CEUs and the memberships and all of these things, it does get overwhelming. I get it. But at the same time, somebody's trying to help you, But yes, don't go to the extreme if you're looking for a job. Try to start out with a temp agency. Just try it. And, if you say, well, Blue, I'm already working a job and, I want something permanent. That's why I wanted to get into this. Well, I mean, I get it. But at the same time, too, if you really want to get into this, you never know that one assignment can lead to. When I worked at the Cancer Therapy Research Center, and it was a 3-month assignment, and they were trying to do this little game where they said, okay, well, we have 3 of you, but we're only going to pick one. And so I didn't get picked, but it wasn't technical ability. It was just the lady was mean. So, that's the bottom line of it all. But when you, that assignment led me to my next assignment, which was a little bit longer. I was up there like 8 months, 10 months, and no, it was 8 months. And I was out there for 8 months and I was trying to get back home. And so, that being there and having that little bit more experience, I started applying, and that's where I started applying for my permanent coding home. So that's where I was able to get into. But had I not gone to the temp agency, I wouldn't have gotten that first job. I wouldn't have gotten that second job. And I certainly would not be here. So sometimes you have to kind of take different and alternative routes, when it comes to finding your first job. And don't dismiss working in like release of information. Release of information, you've been trained in HIPAA, and it is a little bit under what we do. However, working with release of information is going to get you in to the facility, and that's what you want, because ultimately you want to work at a hospital, right? If you want to work at a hospital and you get in just by way of release of information, that's a lot better than getting in through scheduling. Scheduling is a dead end and will not get you, a lot of times it will not get you where you want to go, because a lot of times that's just the schedulers really stay on, like, the secretarial side, and that's not where you want to be. You want that time that you're going to be spending out in the field, you want it to be invested towards something that is going to benefit you later on. So going release of information, that'll get you around the people. Oh yeah, by the way, I'm a medical coder. Oh, okay, well, we have an opening. It may not be right away, but we have an opening for a medical coder, or we have an opening in billing. You want to go over there? Then you're already in. It always makes me think about that one lady that her husband was in a nursing home, and when the pandemic hit, and when I first saw this, and I don't know, because it was just right at the beginning of the pandemic, I was already emotional as it was. And I was like, when I heard the story, I was like, and I was just like crying, because she wanted to see her husband, and they would not let her in. And so they would do the thing at the window and things like that. Well, she wanted to hug her husband. She wanted to do anything she could just to see him, just to hug him. So she got a job as a dishwasher just to get in, because now she's staff, she has to come in. And so that was how she managed to finagle her way inside that nursing home and still be able to hug and see her husband. I was like, oh my gosh. But it goes to show you the determination some people have. If you say it's impossible to find a job, you're really kind of limiting yourself when you do that. If you say, okay, well, that way is not going to work, so let me try another way, you're giving yourself more chance and more opportunity to get in. You're not going to see it as, I can't get in. You're going to see it as, I'm going to find a way in. Because trust me, whatever it is, and you know this, if you I don't have kids, but we all hear about children, and when they're determined to do something, they will find a way and do it. It's like these kids who they have really strict parents, and so they sneak out of the house and they find a way to do it. That's the thing. You kind of have to think about it, that obviously not sneaking out of the house, but you have to think about it in that terms of, okay, they're not going to let me in this way, but maybe they'll let me in through billing, or maybe they'll let me in with prior authorizations, because that'll give me some exposure to coding. I'm not coding yet, but it'll give me exposure to coding. And I don't have to work for free, because I am trained. I am technically trained. I am worthy of a paycheck. I am worthy of a fair paycheck, not just, I'm going to pay you $10 or $12 an hour. We're better than that. Okay. You are better than that. And even having an internship or externship, it's that having that experience is usually very temporary, right? Like maybe a couple of weeks, sometimes it's maybe a month or two. That's still not considered a lot, and at the same time, it can also be dismissed if it's not clearly written, what did you do during that internship? And if you say, well, I didn't really do anything, I just stood around and I observed. Okay, well, what kind of clinic was it? Okay, like for example, it was an ortho clinic. Okay, so did you learn about like casting procedures? Oh yeah, they were talking about that. And then they were talking about like different types of fractures and things like that. Bingo. Now you're talking. So you were interning at a orthopedic specialty where you learned about procedures that are performed in the orthopedic setting. You learned about the diagnoses that are common and injuries, and what all the provider documents as far as like external cause, place of occurrence, what happened, what type of casting did they use. There's different types of casting, and there's different types of casts that they apply. So those are the things that you are learning. Take the time to think about what you learned. What specialty was it? Because even though you say, okay, it's a sports medicine place, at least you're being more specific. The more specificity you have, trust me, the more you'll start to really get those employers' attention. Gail says, why do jobs say coder 1, coder 2, coder 3? Does that mean coder 1 is entry level? Hold on, I'll get to that one. Hi, Sarah. Thank you for joining me. Thank you for all the blue hearts. Sarah says, I'll save this video and watch it later. Thanks for sharing, Blue. I just started my final semester. Yay! I love your information. You provide all sorts of aspects of coding. You are true, Blue. Oh, thank you. I appreciate that. Okay, so coder 1, coder 2, coder 3. For different facilities, they mean different things. Okay, so when I worked at the level 1 trauma hospital, right, I was considered coder 2 because I did same-day surgeries. I did some of the other revolving accounts. But coder 1, typically, not always, because I've also seen it the other way, where coder 1 is for inpatient coders. But at this facility, coder 1 was ER coders. And so coder 3 is one who does everything. And so, and then for some, coder 3 is that they work inpatient. So it really all depends on the facility. So what you have to do is look at the listing itself, right? And see what are they specifically saying that is going to be the tasks of that coder 1, coder 2, coder 3. If they're saying that coder 3 does dialysis coding, okay, well then you know that that's probably what they do. Those ones where there are recurring visits like that. Or if they're saying that you're coding for like same-day surgeries and they say that under coder 2, then you know that that is a surgery coder, somebody who's going to be doing a lot of those same-day surgeries, and the ones that are, you know, just doing those where they're not doing clinic visits, they're not working with E&M, they are just working with the surgeries. And that could be like colonoscopies, it could be like ORIFs, open reduction internal fixation, it could be, you know, any kind of internal surgeries, any of those, you know. So but yeah, that it really all depends on the facility. And I've tried to do a show on those, like what is coder 1, coder 2, coder 3. And so when I was doing the research, right, to put together the show, I was just like, okay, coder 1 says this, all right, good, you know, I'll put this in there. And then all of a sudden I see the next one for coder 1 and it's something completely different. I'm like, okay, so that's not going to work. So it really all depends. Some places it's that way, you know, coder 1 is ER, and sometimes coder 1 is inpatient. So it really all depends on the facility. But like I said, look at the job listing and it'll tell you, it'll say must know modifiers, must know CPT procedures, or must apply correct evaluation and management. Then you know it's like in the clinic and that kind of thing. So that would be what I would say. A lot of the things are in the job listing, like the clues of what they want. I'll get that too, where people will write in and ask me, well, Blue, what do these employers want? It's right there in the job listing. They're telling you what they want. And sometimes they'll come up with some goofy off the wall ICD-9. Guys, you don't have to know ICD-9. It's a retired, it's already gone away, it's discontinued. No one uses ICD-9. What happens when they do that is that HR will actually put out the job listing because they've had a request from the HIM department. And they'll say, well, you know, we need a coder. Okay, well, here's a job description for a coder. Well, that was written back in 2005 when it was ICD-9 times, because you'll see they won't even ask for ICD-10. So again, you know, it really all depends on who's doing it. But sometimes you can really tell, you know, who's doing what, because you'll see some of these that are written very specifically. So then you know it's somebody in the HIM department that wrote it, and it's very recent. So yeah, you can really tell. The ones that are with ICD-9, you know, you can still apply for those anyway. But when you're applying for these ones that they're asking for experience, just make sure that the tasks that you would be doing in that position are just coding, or, you know, maybe reviewing, abstracting, or whatever. That's fine. But if you're looking at something that's more advanced, like CDI or clinical documentation integrity, clinical documentation improvement, you know, obviously you don't want to apply for something like that because that's too advanced for you just yet. So try to go with something that is specific to clinic coding, or specific to same-day surgery coding, or specific to like the ER. You know, if you want to get the most and fastest training, like really boots on the ground, like deep into the pool, you go to the ER. Trust me, you spend time in the ER, you'll be ready for any specialty. And I think that that's really good. When you have that freedom, of being prepared for any specialty, that you can be confident to be plopped in anywhere, and within a couple of days you can be able to find your way, find your feet. There's no greater freedom than that. You know, I could leave my hospital today, not that I want to leave my hospital, but I could leave my hospital today and go anywhere, quite literally. Not just because of my credentials, but because of my knowledge and my willingness to face those challenges head on. So, you know, it really all depends. It was a Amber Alert that came through on the phone. But yeah, so, you know, you just want to make sure that you're giving yourself the opportunity. I know it's a lot. I know it is. But just the more you educate yourself, the better off you will be, guys. And you can't be afraid of it. Because I will tell y'all, I was afraid of ICD-10 PCS for a long time, because I didn't have the very first time I had an encounter with ICD-10 PCS, it wasn't a favorable one. And then I thought, what do I need this for? I don't need this. I'll never need inpatient coding. Contraire. Yes, I do. So now that I said, okay, last year I made up my mind. Last year was a turning point. And last year I said, no, enough of this. I'm not running from this no more. Because I knew enough before to get around, and I could answer questions, but to actually sit and do it, I couldn't do that. And for me, I want to be able to know enough to be confident to get around. So I said, okay, well, it's time to buckle down. So going through a boot camp actually helped me, because I had some knowledge before I got into the boot camp, but it does help when you know. Because if you don't know, oh yeah, you're going to be way lost if you go into those boot camps. But going through that boot camp, that kind of helped me more. Going through the workbook, going through the book itself, that helped me even more. So, you know, that is what made the difference for me. So I hope it makes a difference for you guys. And I hope you take my advice and don't go to such extreme measures to try to get your first job. Don't be discouraged, guys. We all went through this. We all did. All right. So I promised that I was not going to go long on these videos. So I'm going to go ahead and wrap this one up. That's all for me for tonight. But I will be back tomorrow. And if you don't know already, starting in February, I'm going to go to 4 nights a week. It will be Monday through Thursday. And they will be pre-filmed shows. So I will let you guys know what the show is going to be during the day, so that way you know what to tune in that night. And it is going to be for the month of February. And then at the end of the month, the last Friday of the month, I will do a live, so that way, you know, I can just say, hey, how y'all doing? And y'all can tell me how much y'all miss these lives. So, but anyway, I'm going to go ahead and wrap this one up. Thank you guys for being a wonderful audience, and like, subscribe, share, and I will see y'all next time. Bye.